Good morning, dear colleagues, excellencies, ladies and gentlemen. Thank you all for joining us today at this side event on the occasion of World Autism Awareness Day. A special welcome, of course, to our speakers in Asia and in Africa who are joining us late at this day in their end. I also would like to acknowledge and express my appreciation to our co-hosts, the missions of Bangladesh, the state of Kuwait, Poland, Republic of Korea, UNDESA, and of course, Autism Speaks. On the occasion of World Autism Awareness Day, this day serves to highlight the importance of improving the quality of life for those with autism and ensuring they can lead full and meaningful lives as an integral members of their societies. Let me remind you that 14 years ago, in 2007, the United Nations General Assembly has adopted a resolution that proclaimed April 2nd as World Autism Awareness Day, a resolution that has been proudly presented by the state of Qatar. Throughout the years, Qatar has proven its leadership in autism research and awareness campaigns. Most importantly, we have paid great attention to the care of people with autism, and we have been keen to enact legislations domestically and internationally that preserves the right of this very important group of society. The COVID-19 pandemic, of course, has highlighted the ongoing digital divide and amplified existing inequalities. The most vulnerable, including those in the autism spectrum disorder, are among the hardest hit. Affordable assistive technologies and access to them is critical to the realization of the rights of persons with disabilities and the rights of persons, of course, with autism in all aspects of society to build back better. As the Secretary General have said just a few days ago, we need to work together with all persons with disabilities and their representative organizations to find innovative solutions to recover better and build a better world for all. We have, of course, an extraordinary panel to discuss these issues today. Current innovative research and possibilities for cooperation is widely open. Most importantly, we will hear from some autism self-advocates. Dear colleagues, let me begin, of course, by thanking again my dear colleagues, the co-sponsors of this timely event. And in this, it gives me great pleasure and honor to give the floor to my fellow co-chair, Ambassador Rabab Fatima, the permanent representative of Bangladesh. Dear Rabab, the floor is yours.
Thank you, dear Alya. Excellencies, ASG, Maria-Francesca, distinguished panelists, Mr. Andy Shee, dear friends and colleagues, very good morning. And on behalf of all co-sponsors, I join Ambassador Al-Thani to extend a very warm welcome to our event today marking World Autism Day. We're very pleased to have an outstanding panel of experts with us today, and we are looking forward to a very rich and productive discussion. Excellencies, as Alya has said, we are here to discuss the impact of COVID-19 on one of the most vulnerable and challenged segments of our society, that is children with autism spectrum disorder. Children and persons with autism react differently to changes as they tend to thrive on consistency, structure, and routine. Unfortunately, such an environment is seriously compromised due to the pandemic. The education system as a whole has suffered severely in this pandemic. According to UNICEF, up to 1.6 billion children were affected by school closures. Although many societies try to adapt to the situation by introducing virtual learning, only 33% of children and young people globally have internet access. This digital divide further exacerbates the vulnerabilities of children with autism, especially those living in poverty. Excellencies, in Bangladesh, we have put in place strong legislations and programs to protect people with disabilities and neurodevelopment disorders, and this includes support and learning centers across the country and other referral services, including disability inclusive e-services. Raising general awareness and mainstreaming the needs of this group of children and individuals with special care is a key priority for us. And this commitment and leadership comes from the top, from my Prime Minister. We are very pleased to have today with us the Chairperson of our National Advisory Committee, on neurodevelopment disorders and autism, Ms. Saima Wazed, on the panel today, and we look forward to hearing more from her. Excellencies, dear colleagues, as we strive to recover better, we must consolidate our efforts at the global level to promote and protect the rights, to their rights, to support efforts at the national level for the well-being of people with autism. We must ensure their full inclusion in every aspect of our societies. There's certainly much more that needs to be done, as we realized very dearly during this pandemic. Let me briefly highlight a couple of points before we move on to the panelists. First, we need more investment for research and development of new technologies to support individuals with autism disorder, especially as we saw during the pandemic. Secondly, we must bridge the digital divide so that technologies be made available to and accessible by all, regardless of their social or economic status. We need to explore means to help children with autism learn and develop skills without any disruption, including by making available assistive devices and online-based therapies. The pandemic has made us realize the critical need for access to such technologies. Finally, dear colleagues, we need to use every possible means to raise awareness on the needs and rights of persons with autism and ensure their access to decent work and other opportunities on an equal basis so that no one is left behind. Relevant international normative instruments perhaps needs to be strengthened to support national efforts in this regard. Let us work together to come up with innovative solutions to better integrate people with disabilities into our communities. And we look forward to hearing the expert opinion of the panelists today, and also from my dear colleagues from the other co-sponsoring missions. There are families, people with ASD, our loved ones, and equal members of our society entitled to every right that we all enjoy. I thank you. Handing it over to you, Alya.
Thank you so much, dear Ambassador Rabab. I will move on now, and it gives me great pleasure, of course, to give the floor to His Excellency Ambassador Ronaldo Costa, the permanent representative of Brazil.
Thank you very much. Good morning, distinguished colleagues, distinguished panelists, participants. It's a pleasure to be here. I would, of course, like to start by thanking Ambassador Al-Thani and all the other co-sponsors for her leadership role in particular in organizing this event for World Autism Day. I am honored to be with you today. There is an underlying and yet very powerful message in the call for awareness that brings us here this morning. The core lesson we must take is that raising awareness requires that we combat ignorance and prejudice. Persons with autism know this all too well. Their fight against discrimination is a daily and constant struggle. Whilst we may, and in fact should, celebrate their resilience, the quest for inclusion cannot be a fight they should wage alone. As member states of the United Nations, we have a commitment and an obligation under the Convention on the Rights of Persons with Disabilities to build a more inclusive society for all. In order to achieve this, we must recognize that persons with autism are capable of being effective agents of change in the communities in which they live. As such, they have the right to be included in the design and implementation of public policies that affect them. We cannot thrive locally, nationally, or globally if we don't embrace diversity. On this World Autism Day, let us promote visibility and inclusiveness for persons with autism, while also exchanging experiences on how to remove the cultural barriers that prevent us from building more inclusive societies for all. Thank you very much.
Many thanks, Ambassador Ronaldo. It gives me great pleasure now to introduce His Excellency Ambassador Mansour Al-Otaibi, the permanent representative of Kuwait.
Thank you very much, dear Alya. Good morning, dear colleagues, and everyone who's joining us virtually today for this important event. At the outset, I would like to thank my fellow co-sponsors, Bangladesh, Brazil, Poland, Qatar, and Republic of Korea. in addition to our colleagues and friends from UN Department of Economic and Social Affairs and the NGO Autism Speaks for putting this event together. I would also like to welcome and thank everyone who is turning in to this event online for being here with us today on the occasion of Autism Awareness Day, which was on April 2nd to discuss the important issue of the impacts of COVID-19 on the autism community and how technology can support a better and more robust, equitable response. As many of you are already aware, the autism community has been more severely affected in many ways by the pandemic, including the challenges of dealing with the public health measures, in addition to the immense impact of school and work closures on children and adults with autism, many of whom have been unable to get medical care, behavior therapies, and education services they need to reach their full potential. These are only some of the many challenges being faced by the autism community all over the world, including my country, Kuwait, where we are striving to ensure that the needs of the autism community are being met as we continue to deal with the fallout of COVID-19 pandemic. I look forward to hearing today's discussions as we explore the many ways technology can be used to respond and address the COVID-19 pandemic. COVID-19's pandemic disparate impact on the global autism community, in addition to looking at the positive role that global partnership and multilateralism can play in this context. Thank you very much, dear Alya.
Thank you so much, Ambassador Mansour. It gives me great pleasure now to introduce Ambassador Joanna Wronecka, the permanent representative of Poland.
Thank you very much. I would like to thank the Permanent Mission of Qatar for organizing this very important meeting. I am also honored to be with you and among the co-sponsors. A few days ago, we celebrated the annual World Autism Awareness Day, which aims to remind us about the need to recognize people living with autism and to highlight the importance of improving the quality of life of those with autism, as well as promoting their equal enjoyment of all human rights. People with autism face multiple challenges, including barriers to accessing education and employment on an equal footing with others, denial of the rights, and limiting of the freedom to make their own choices. The current COVID pandemic has brought further negative effects on the person on autism spectrum. Due to the lack of accessible information, many persons with autism experience problems with understanding what the COVID-19 is and the nature of measures required to fight it. They also face challenges in implementing social distance and hygiene-related regulations of pandemic. Moreover, they are vulnerable to exploitation by others, since the usual community support which they received before the pandemic no longer functions to protect them. The pandemic has shown us as well how important technology in our lives is. For many people on the autism spectrum, access to affordable assistive technologies is prerequisite to being able to exercise their basic human rights and participate fully in the life of their communities, and thereby contribute to the realization of the Sustainable Development Goals. Assistive technology can reduce or eliminate the barriers to their participation on an equal basis with others. I would like to share with you some of our domestic policies in promoting the rights of persons with autism. Policies and programs implemented by Poland aimed at enhancing the protection and promotion of rights of persons with disabilities, including the mental disabilities, and are based on the principle of the individual approach. Therefore, the primary concern when selecting the type of support are the specific needs of an individual person. It is also important that these policies are coherent and apply to all aspects of life. Poland provides an inclusive education system that enables integration of children with disabilities. at all levels of education. Educational institutions employ teachers with appropriate qualification and teacher assistants or assist children with special needs. Other people diagnosed with autism can count on additional support when undertaking professional activity and employment in both the protected and open labor market. Employers are required by law to provide them with appropriate working conditions. They should also take into account their individual needs. Poland also ensures that persons with disabilities can fully exercise their political rights. There is a number of special regulations to allow them to participate actively in the election, such as postal vote or proxy vote. Therefore, I reiterate Poland's commitment to promoting and protecting the human rights of persons with autism. I should conclude by express hope that today's event will not only provide an opportunity to raise awareness about challenges faced by persons with autism, but also highlight their talents and important contributions to the society. Let us also renew our promise engraved in the 2030 Agenda for Sustainable Development to leave no one behind and ensure that all people can contribute as active members to peaceful and prosperous societies. Thank you very much.
Thank you so much, Ambassador Joanna. And now, of course, it gives me great pleasure to give the floor to His Excellency Ambassador Hyun, the permanent representative of the Republic of Korea.
Thank you, Alya. I'd like to express my sincere thanks to the State of Qatar for hosting this very important event. I also thank Alya for inviting me to speak today. I must confess that I do not know much about autism, but I do know how difficult it is for those with autism to face high barriers in their daily lives. And the barriers have gone up at this time of pandemic. Therefore, we have to explore, research, and do something more to study the relationship between autism and technology so that we can enhance the accessibility for individuals with autism. In doing so, we need international cooperation because we need more case studies, more success stories to share and to emulate. Eventually, we will build a global autism community to raise their awareness for their rights and inclusion at all levels. Back in 2006, Korea played a constructive role at the United Nations to make the Convention on Rights of Persons with Disabilities. Since then, every December, the Korean mission just in front of the United Nations building hosted a reception for the participants for the convention. And every year, we invited some musicians with disabilities, people with disabilities, including people with autism. In 2019, in December, right after my arrival here in New York, we held a reception, and I was mesmerized by the great performance of musicians with autism. It was a personal victory and demonstration of resilience of people with autism. I promise you today that when the pandemic is over, because last year we were unable to hold it, we will again invite you all to this reception and let you listen to this great performance by the people with autism. So I hope that today's event will be an opportunity to explore ways to ensure multi-sectoral partnerships and craft joint messages to respond to the current crisis of pandemic and promote and protect the rights of persons with autism and other development disabilities. Thank you.
Many thanks, Ambassador Hyun. And again, I would like to thank my fellow colleagues, ambassadors and co-sponsors. Very much grateful to your engagement and your presence with us today. Dear colleagues, we need now to set the tone for the discussion, and no one can do this better than Her Excellency Mrs. Maria-Francesca Spatolisano, who is the Assistant Secretary General for Policy Coordination and Integration Affairs within UNDESA. Of course, Mrs. Maria-Francesca is known to be a key in advancing the rights and inclusion of persons with autism in the UN system. Dear Maria, the floor is yours.
Thank you very much. Excellencies, distinguished delegates, ladies and gentlemen, on behalf of DESA, the UN system's global focal point on disability issues, I would like to express my deep appreciation to the state of Qatar and to Autism Speaks. Thank you for making this a commemoration of the World Autism Awareness Day possible. Our department is engaged in the global process of supporting recovering better towards an inclusive, accessible, and sustainable post-COVID-19 world. Together with the community of and for persons with autism, including member states, other UN entities, academic institutions, the private sector, and many other stakeholders, we are putting into practice the commitments of the Convention on the Rights of Persons with Disabilities and the 2030 Agenda as an integral part of the response and recovery from COVID-19. The role of technology, especially information and communications technology, is a fundamental component of our analysis and policy recommendation, as you all know. We are looking forward to today's exchange and future exchanges too in these crucial issues on the global agenda. Through today's roundtable, we will explore the vital importance of ICTs in creating enabling environments for persons with disabilities, in particular for neurodivergent persons, and the role they play in practical solutions in education, in employment. A number of internationally agreed reference documents exist, as you know. First of all, the Convention on the Rights of Persons with Disabilities, the 2030 Development Agenda, and the SDGs. And others, which include, for instance, the 2003 Declaration of the World Summit of the Information Society, and the 2014 New Delhi Declaration on Inclusive ICTs for Persons with Disabilities. These address the accessibility and affordability of these crucial technologies. And these are essential conditions, affordability and accessibility, for an inclusive society and development, especially when we think about inclusive education and decent work. So reasonable accommodation for persons with disabilities, including those with autism, as set out in the Convention, should be an integral part of our action for the 2030 Agenda. As we all know, though, progress is uneven and dispersed. Several barriers remain for scaling up the use of ICTs, including gap in awareness, access, affordability, infrastructure coherence, and coordinated policy. Now, the 59th session of the Commission for Social Development deliberated on the priority theme of socially just transition towards sustainable development, the role of digital technologies on social development and well-being for all. It adopted a resolution, which is very important because it has policy recommendations to leverage digital technology to improve the well-being of all. And some of these recommendations, let me mention two. One is to encourage member states to seek universal connectivity by applying, among others, a disability responsive approach to all interventions on digital technologies. And another one, providing targeted subsidies, engage multi-stakeholder cooperation, and facilitate public-private partnerships to address specific barriers to digital inclusion. Indeed, ICTs have enormous potential for making a wide range of current and future services more accessible. And moreover, such technologies are creating a greater demand for wider access to information so as to promote social inclusion. ICTs enable persons with autism by offering differentiated instruction and personalized learning. In the workplace, ICTs empower persons across the autism spectrum, many of whom have difficulty operating in traditional environments, to work remotely and communicate with ease. Yet, online work and schools are only feasible in households with electricity, internet, and proper technology to participate. Even before the pandemic, only 66% of primary schools in developing countries had access to electricity. Additionally, in many low and middle income countries, the learner to computer ratio can reach 500 to 1. Furthermore, in developing countries, only 35% of households have a computer and 41% have internet access. Households, including one or more persons with a disability, are less likely than others to be able to afford these services and technologies. The COVID-19 crisis has only exacerbated these gaps, as you have already highlighted. 40% of the least developed countries have been unable to provide support to learners at the risk of exclusion, including persons with autism. Persons with autism who were unable to learn or work remotely now face disproportionate rates of unemployment and disadvantages also in returning to school. So what can we do to close these gaps? We need to remove these barriers to universal ICT access by aligning the local, national, regional, and global efforts. To meet these challenges and respond to the increased demand for these technologies arising from the COVID crisis, our department and other UN entities with the member states, organizations of persons with disabilities, and the private sector, we are working together to further implement the Convention on the Rights of Persons with Disabilities and the 2030 Agenda through disability inclusive response and recovery. These actions include the UN Disability Inclusion Strategy, launched by the Secretary General in 2019, to mainstream the disability inclusion in the operational pillars of the United Nations: development, human rights, and peace and security. We are also strengthening research and analysis on the COVID-19 impact, as you know, and producing a series of policy briefs, which include recommendations for action to address the situation of those left further behind. And in addition, together with leading member states and partners, such as the government of Qatar, we contribute to building new networks of key stakeholders, including persons with autism, and their agencies and leaderships through a wide range of panels and events. Let me recall here that with the leadership of Qatar, indeed, the 2019 International Conference on Disability and Development provided a significant opportunity for the international community to explore the way forward for the disability inclusion in the global agenda. And I was honored to be a key partner in this conference and follow up. So in conclusion, as we recover from COVID-19 crisis, we should recognize this process as an opportunity to transform our society towards a more inclusive and accessible world for persons with disabilities, including those with autism. In close collaboration among all stakeholders, let us continue to promote awareness and understanding of the situation of persons with autism in this recovery period. We must strengthen our capacity, maximize synergies, and expand our networks to advance universal ICT access, create enabling environment for all, including persons with disability, with autism. And together we can create a more disability inclusive post-COVID world, one in which no one is left behind. And I look forward to the panel discussion. Thank you very much.
Many thanks, dear Maria, for framing our discussion today. And now, of course, it gives me a great pleasure to introduce our moderator for the panel, Dr. Andy Shee. Of course, Dr. Andy is one of the biggest names in autism care and research. As the Senior Vice President of Public Health and Inclusion within the US-based organization Autism Speaks, Dr. Andy and his team currently support ministries, government agencies, and leading non-government organizations in more than 70 countries to deliver better outcomes and quality of life for tens of millions of individuals and families. Dr. Andy, thank you so much for accepting to moderate the panel today, and the floor is yours.
Thank you, Your Excellency, for the very kind remark and for this privilege of serving as moderator for this sure to be rich conversation. Your Excellencies, distinguished guests, ladies and gentlemen, it's been more than a year since COVID-19 interrupted and changed life as we know it. Businesses shuttered, schools closed, and families separated. Existing disparities were revealed and widened, as the pandemic often ravaged the most disadvantaged and the most marginalized among us. Recent studies have shown people with developmental disability, like autism, are desperately affected, including higher risks for severe illness and mental health challenges, and less access to education and social support. The pandemic also highlighted the central role technology plays in people's life. Just as we are meeting by video conferencing technology for the first time since the establishment of World Autism Awareness Day by the United Nations, the ways we enhance autism awareness, acceptance, understanding, and inclusion, and the ways that we serve our families and our community also being transformed by technology. Today, we are fortunate to have with us a panel of distinguished experts to share with us their experiences over the past year and discuss the important roles that technology may play not only in timely and effective response, but also in equitable recovery, so no one's left behind. For our conversation, I will introduce each panelist along with 2 questions for our expert to consider as part of their remarks. Without further ado, it gives me great pleasure to introduce our first panelist, Dr. Noof Mohammed Alsiddiqi, the Health Lead for National Autism Plan at the Ministry of Public Health at the State of Qatar. The suggested question for Dr. Alsiddiqi are, as a public health professional actively working to enhance support and services for the autism community in Qatar, and as a mother of a child with autism, how would you describe the experience of families during the pandemic? And then the follow-up question, Qatar's Ministry of Public Health launched a state-of-the-art autism e-learning platform last June to offer parents and caregivers a digital source of scientific information covering educational, social, and health-related topics. How did it support our families during the past difficult year? What roles do you anticipate the platform will play in supporting the equitable recovery in the coming years? The floor is yours, Dr. Alsiddiqi.
Thank you, Andy. Your Excellencies, distinguished guests, I'm honored to be here today, and I'm representing a very strong community. It's the autism community. And definitely, Andy, I would like to share my slides with you. And to our guests, we were affected. The autism community was suffering. As a mom of an 8 years old autistic child, there was very big difficulty to explain to my child what is COVID-19 and how the pandemic is so risky and so dangerous to go outside. One of the issues that I faced and challenges is just simply how to wear mask and how to teach him to wear mask. And definitely when his routine was broken and changed, it disturbed his sleep and it disturbed my sleep too. So I was suffering and all the mothers and parents were suffering too. There was another aspect, which is the online learning and how we can adapt to it. There was no direct interaction. Our children were away from their teachers, their friends, and I was supposed to deal with my child alone. I felt alone, and all the community felt that they are alone. So we started actually as parents to think, how can we support our children? So we put a lot of pressure actually on them to teach them at home. The good aspect that we had more time to spend with them, but we didn't know how to do it. We were not directed. Everything was new. So lots of tantrums with Ali and all the kids and even the adults was being actually created at that time. They were having a lot of anger issues and psychological effects. So what we thought of in the ministry, as a mom, as a parent, and the parents were actually trying their best to communicate with me and asking me if there's a solution. We thought of the technology. We had culture barriers, definitely. In our conservative culture in Qatar, we thought that definitely we'll face lots of females, they don't want to show their faces. And definitely there are a lot of Arabic kind of softwares or applications in technology or supporting the Arabic language. So we started to think about how can we solve this problem. And the outcomes was the launch of the e-learning platform for autism. And it was a great success because this platform actually was succeeded because of the partnership with all the providers for healthcare, education, and social services in Qatar. And you can see their logos over here. I'm very proud that by establishing this platform, we created a home for those parents. They felt they are empowered and they were actually receiving a lot of information through it. And what happened is that they started to learn how to deal with their kids. There were a lot of recorded videos from those experts showing how to deal with the child at home and how to teach him. And we had monthly interactive sessions with the experts, showing the parent and interacting with them, answering their questions and showing them how to use all the guidance that the experts were giving. Now, the challenges definitely were there. It wasn't easy to launch a platform without any financial resource, but the ministry have done their amazing, great teamwork where the IT people support were there and the leaders, especially Dr. Hyun al-Kuwari, were very supportive to this platform. So we continued actually monitoring the visits of the attendees, and we had even increasing numbers. Our data shows that we have even international people joining us on the platform because the platform was launched on the ministry website. And it was an easy, free access to it. Now, our intention in the future, not to stop. We have to continue using technology and the parents has to learn. I'm one of the parents who wants to learn. Our intention definitely to digitalize our services. We have to have virtual interactive support where the parents can really go and talk directly to those experts. We have to provide them with a 24-hour response, especially for emotional or psychological issues. The telehealth definitely is part of all the health organizations, and we have to really connect those experts to the parents. We continue to create a forum of continued education, and we launched this year during the World Autism Awareness Day our first virtual annual symposium for autism. And we had a lot of great speakers from around the world and even from Qatar. We had a workshop virtually, which was conducted before even the symposium. We had a lot of people coming from around the globe actually joining us. And I'm so proud of all this happening, and will continue always supporting the parents who are always really proud of any support from the government here in Qatar. So thank you.
Thank you so much, Dr. Alsiddiqi. Now it gives me great pleasure to introduce our next panelist, Ms. Saima Wazed, Chairperson, National Advisory Committee on Autism and Neurodevelopmental Disorder, Bangladesh, and World Health Organization Expert Advisory Panel on Mental Health. The two questions I have for Ms. Saima are, Bangladesh has made great strides in recent years to enhance the well-being and outcome of individuals and families affected by autism and other developmental disability, including the integration of mental health intervention and universal health coverage. Please share with us how the pandemic has affected our community in Bangladesh and the government's ongoing effort to support our families. And the follow-up question is, what role has technology played in Bangladesh pandemic response, and looking forward, possibly play in an equitable recovery? Ms. Wazed, the floor is yours.
Thank you so much, Andy. Good morning, Your Excellencies. It is really a pleasure to be here. It's wonderful to hear all of our permanent representatives really talking about autism in such a constructive and proactive way. This is a very different conversation than when we first started a journey on autism. The things that we are talking about are real challenges. And what is wonderful is to see the commitment that countries have. In Bangladesh, like in every other country, families have suffered severely. However, for the last 7 years, we have worked together with various stakeholders, various departments, and develop a national strategic plan that is very comprehensive. Our National Advisory Committee has 15 members. So the involvement of many different ministries and departments from the onset, along with their policies and awareness and programs within that, has helped a lot in Bangladesh. And we see the result not in just a better understanding, better awareness, but we see the willingness to be flexible, to implement programs that are supportive of families. In Bangladesh we have a very good social support system. We have extremely good infrastructure for ICT, as well as a robust community-based health system. And during this global pandemic, it has actually come in handy and been very useful to provide support to families in various different ways. So, for example, one of the first things that last year at this time, when the pandemic was at its most severe and families were, there was a lot of relief that was provided. There was funds, the government stipends from families were being provided, particularly for families with disabilities. It was hard to understand really families with children on the autism spectrum, how they would leave the family members behind and go and be able to obtain just do simple things as get groceries and food. So along with almost 3,000 families for 3 months, close to 4,000 families over a period of 3-4 months, we were able to provide relief that reached the communities, the individuals themselves. We partnered with local commissioners, district commissioner's office. We partnered with the Neurodevelopmental Disability Trust, identifying the most impoverished families, and local partners, almost nearly 30 autism and disability organizations, to ensure that they were able to get sanitizing products, get basic food, so that at least for 2-week supplies at a time. And this was done in addition to all of the other government donations. We do have, our Ministry of Social Welfare has, throughout the pandemic, provided special stipends, special assistance. But and on the outset, one of the big challenges for autism has been the fact that many especially families with very high functioning children who are not sort of counted, not, identified and within the service system, because of the social stigma that families face, can continue to face. Counting them into the group and ensuring that they need and the services that they're the services that they need continue to receive them. So bringing them into identifying them, ensuring that they have the right identification cards, right support, that was a big challenge that was done. Fortunately, we were the use of our ICT infrastructure, we were able to do that. Another big challenge was certainly that was mentioned by the previous speaker was the fact, the learning. And learning not just in the schools, the supports, the therapeutic interventions, and these were provided, but the fact is, the learning that has been done, the therapies we have not used technology. And families don't always have the right tools in the home or even the network bandwidth to be able to provide that. So many months were sort of wasted and a lot of effort has been provided. Fortunately, now a year later, when we talk to families, when we talk to schools, they have been able to adapt a lot of the support services, a lot of the interventions. But again, doing it in a much more systematic way, doing it where we're measuring the impact continues to be a challenge. Fortunately, we have partnered a while ago with the CAS Center in Peru to train our teachers. And we've used this pandemic as an unfortunate event as an opportunity to adapt to those interventions, adapt teaching methods, and implement them and translate them into families. Another thing that has happened in Bangladesh, I have to talk about, is that before, the attitude of many families in Bangladesh was that a child has a disability, we're going to take them to the center, we're going to take them to the specialist. And because parents feel helpless, and this continues because they are truly helpless, because they're not really taught how to work with the children. There is no opportunity really to learn in a concrete way, and it's a very complex issue. So what has happened now is families have been almost sort of compelled to learn because they are home. And this has formed this partnership between the specialists, between the schools and the individuals and within the families, and teach and translate the technical content, the interventions that are used typically in somewhere else, in a school and center, not always translatable into the home and everyday environment, to really translate that into everyday life. Because the issue with autism all along hasn't been that we don't have the best interventions, is that the interventions are not always translatable to real life. And we're not always easily able to enable individuals on the spectrum to really live productive lives, to live fulfilling life, to be participants in their families, in the communities, and in the economic participation within their country. And that's the glass ceiling that we constantly are unable to reach, because frankly, if you're not an economic contributor for your country, for your community, for your family, you're not valued. And unless and until we address that aspect and think about how we can take an individual with any disability to reach that goal, we are not going to really make a big difference in that person's life. So, this is wonderful to be part of this conversation, and I hope that with a lot of the policies and programs, we can start working towards reaching that goal. Thank you.
Thank you so much, Saima, for sharing your thoughts. It gives me great pleasure to introduce our next speaker, Ms. Ursula Wenhoven, IT representative to the United Nations. Ms. Wenhoven, I have two questions for you. According to ITU's website, quote, the COVID-19 crisis has not only highlighted the critical role information communication technology, or ICTs, for the continued functioning of society, but also brought to the fore the starting digital inequities between and within countries, unquote. Please share with us a few examples how ITU is helping the country to fully utilize digital technology to respond to the pandemic. In a follow-up question, ITU Secretary General Hulen Zhao has stated, quote, as the world recovers from and adjusts to the new normal created by COVID-19 pandemic, ITU is mobilizing around the United Nations call for Build Back Better. Please give us a few examples how ITU is addressing the commitment, especially given the challenge of the inequity that was stated previously. The floor is yours, Ms. Woodhoven.
Thank you so much, Excellencies, distinguished delegates, ladies and gentlemen. ITU is so pleased to be part of this important session on this essential day and expresses our deep appreciation to the Permanent Mission of Qatar and Autism Speaks and the other organizers for this opportunity. During COVID, digital communication has increased substantially, including due to shifts to remote working and learning, transacting more goods and services online, and even meeting key human needs like accessing critical information and staying in touch with loved ones. And yet, just under half the world is not yet connected to the internet. Persons with disabilities are overrepresented among those without access to ICTs. As we recover from this crisis and build back better, we need to ensure that no one is left offline. ITU is helping countries to fully utilize digital technologies to respond to and recover from COVID-19, build preparedness for future global emergencies, and achieve the SDGs for all people everywhere. Inclusiveness is one of the 4 pillars of what our ITU Secretary General calls the 4 I's: infrastructure, investment, innovation, and inclusiveness. Adherence to these pillars can drive connectivity and guide countries in responding to COVID-19 and in building their preparedness for future emergencies. The ability to access information is a human rights issue. The UN Convention on the Rights of Persons with Disabilities was the first human rights treaty that recognized access to ICTs as a right that persons with disabilities should be able to enjoy, and that obliges state parties to promote a universal design approach in the development of new technologies. Each person with autism has a distinct set of strengths and challenges, and ICTs are key tools that can be tailored to support those strengths and help address those challenges. These tools are not currently available to all, further compounding disadvantage between digital haves and digital have-nots. Affordability, as was already mentioned in this session, remains a really big issue for connectivity, devices, and for software. Universal design is a key way that costs can come down and accessibility can be increased. It can also inspire innovation that benefits the wider group and reduces the risk of bias. For example, technologies such as AI, if not designed in an inclusive way, can present opportunities and challenges for persons with autism. Virtual assistants may not take account of speech patterns of some persons with autism, and AI-assisted security cameras may interpret the way that some autistic people move as suspicious. Higher quality and more inclusive products are developed if the teams developing them are more diverse, and if they take account of the diversity of their users and with end user participation and involvement. ITU advises that persons with disabilities should be involved as validators in the design of technologies to make this process inclusive. The diversity of persons with disabilities themselves and their needs must be recognized in universal design. The CRPD acknowledges the instrumental role of technologies, including assistive ones, in enabling persons with disabilities to exercise their rights and freedoms. But what should be done by leaders and policymakers to ensure an equitable and equal access to ICTs? There's a need to consider at least 3 fundamental aspects, all of which begin with A: availability of infrastructure to access the internet, affordability for the internet service and the necessary devices, and accessibility of ICTs, the possibility to access the available information and to communicate, which also encompasses adoption of policies and strategies to ensure full inclusion and participation in digital society, to benefit from the empowerment that ICTs can support and be able to access digital information products and services, and accessible ICTs such as smart ICTs that have embedded accessibility features from the design stage. And finally, adoption of the ICTs to ensure that capacity is built to know how to use the technologies. Regarding what ITU is doing specifically, internally, we're making ITU more accessible. This includes our facilities, events, documents, and corporate communication tools, and raising our own awareness. And the UN Disability Inclusion Strategy has been very helpful in spurring our further efforts. Externally, we're working to make ICTs more accessible and promoting the empowerment of persons with disabilities through the use of ICTs worldwide. ITU supports members and stakeholder efforts to ensure that these technologies are available, affordable, and accessible to everyone by providing policy and strategy advice, developing and promoting accessibility-related standards for technology, making available resources, including toolkits, thematic reports, and regional assessments, developing and delivering online self-paced and face-to-face trainings and capacity building sessions, as well as through knowledge development platforms, which enable sharing experience and best practices at regional and global level. See, for example, the World Summit on the Information Society Forum track on ICT accessibility and conferences such as Accessible Europe and Accessible Americas. We've also published guidelines on how to ensure that digital information, services, and products are accessible by all persons, including persons with disabilities during COVID-19. Thank you very much.
Thank you very much, Ms. Weighoven, for sharing your thoughts. It gives me great pleasure to introduce our next speaker, Dr. Dina Al-Thani, Assistant Professor at the College of Science Engineering, Hamad bin Khalifa University. Dr. Al-Thani, I have two questions for you. How did assistive technology support individuals and families affected by autism during the pandemic? And a follow-up question, what do you think are the opportunities for technology, including assistive technology, in supporting our community's recovery from the pandemic? The floor is yours, Dr. Al-Thani.
Thank you very much, Andy. It is such a pleasure to be among such a great group of distinguished speakers. I would also like to thank Your Excellencies, the mission of Qatar and the UN, and the other missions, as well as an Autism Speak, for organizing such an important event. Basically, for years, there have been numbers of technologies that aid the process of learning and communication for individuals and families affected by autism. These technologies has came across very handy during this pandemic. However, we all know, as all and most of the distinguished speaker said, it is not enough. Due to the pandemic, we all know that academic institutes, including schools, centers, universities, all went into full shutdown at many periods. In fact, now in Qatar, we also going through the second lockdown for educational institutes. So we know that in-person classrooms are no longer the only way of teaching. We know that there will always be a chance to provide virtual teaching from a pandemic perspective or even from other perspectives. So this virtual classroom has created, as we all know, and as the speakers highlighted, that it created a challenge, not only for the autistic students, and in fact, for people who do not have access to technology, do not have access to internet. It also created a challenge to the parents of the children. As Dr. Noof highlighted, they went into a struggle actually in learning the different ways and tools to basically assess their children. Autistic children, as we all may know, are experiencing now learning loss and skill regression in terms of missing the in-person instructions through the live speech, occupational and behavioral therapy. This absence on the long run will for sure create an impact on their child development and on their independency when they become adults. We know that augmentative and alternative communication tools, assistive technology tools has been there for years, and there are many useful apps that we know about. From learning and to communication, these apps played a strong role across the years, and in fact, people praise them. However, as we all know as well, those were not enough. In research, in particular, we encourage finding more alternative solutions, from the use of virtual to augmented reality to the use of social robotic, and as Ms. Ursula highlighted, the use of AI. We all know that there is a potential to assess children in autism in education and communication in particular. During this pandemic, my team at HBKU, Hamad bin Khalifa University, have been awarded a fund to develop a response tool for children with autism. This tool was an interactive educational platform that utilizes mixed reality. By mixed reality, we mean virtual reality as an augmented reality as well. This work is, of course, did not come all of a sudden. It was a continuous collaboration with centers in Qatar way beyond before the pandemic, and it was a continuous collaboration with Meda Assistive Technology Center as well. This work emphasizes on helping children with autism to learn using the new technologies we have today, and in particular augmented reality, as many have highlighted in research, their potential with kids with autism. This application provided the child a platform to learn a vocabulary, play games about emotions in a fully mixed reality platform. This mixed reality platform basically substitute the absence of a teacher in this pandemic, of course, by using interactive avatars and robotic character that lead the student toward fun and gamified experience of learning. This platform, of course, has been designed with teachers and specialists of autism, and by saying that, I would also like to highlight the role of Shafallah Center in supporting us, and Meda Assistive Center in supporting us in the design, the collaborative design of this platform. This platform as well provide the teachers the possibility of fully communicating virtually with the parents, with the children. It also allowed the teacher to see and monitor the child's performance through a virtual dashboard. There is a lot of opportunity, as you may see in the world of machine learning, artificial intelligence, sensing technologies, virtual reality, as I've just described, and augmented reality. There is a lot to be done. However, there is a lot of research needs as well to be done to know the applicability of these tools, and to avoid bias, and to avoid any challenges that might face us in the process of learning and education for children with autism. From assistive to personalized learning, I believe that technology could play a vital role in supporting learning communication for children and adults with autism. And from this important platform, I'd like to shed the light on the importance in believing in funding research in assistive technology, and these initiatives needs to firmly be connected to the societies and the context and the communities around the world. Thank you.
Thank you very much, Dr. Al-Thani, for sharing your thoughts. Next, I'd like to introduce our expert, Dr. Chiara Civilli from the Department of Mental Health and Substance Use for Health Organization. Dr. Civilli, I have two questions for you. As the world's leading public health organization, what have you learned as the major challenges for the global autism community during the pandemic? And I understand as part of WHO's pandemic response, the Department's Mental Health and Substance Use have been developing new technology platform for program and content delivery, as well as help build capacity for better support the autism development disability community. Please share with us how WHO plans to leverage its technology, support an equitable recovery for our families around the world. Dr. Civilli, the floor is yours.
Thank you very much, Andy, and I would like to thank the permanent mission of Qatar, Autism Speaks, the other co-hosts and organizers of this high-level event for having me join this very important conversation today. I would like to share two lessons learned, two reflections of the experience during COVID pandemic, as well as highlight the work around technology in relation to helping persons with autism and carers. The first, I think some of the distinguished speakers before me have highlighted the recognition of the uneven impact of COVID pandemic on the population, also, particularly thinking about children and families. When we think about it, the vulnerable populations, or people that may be more exposed to significant negative impact of the disruption of services, certainly, we need to recognize, that children with autism, persons with autism, and their carers are part of this group. But I would like us to reflect also about the significant impact that the COVID pandemic has had on the general population, also particularly of children, young persons, women, and particular carers, and their well-being and mental health, as an opportunity, for us really, to see the COVID pandemic as an entry point to advocate, and maybe, more strongly advocate for inclusive societies, and societies that really recognize the importance of nurturing and enabling environments for all children and families and carers, and also particularly for children with autism and their caregivers. During the COVID pandemic, we know that children all over the world have experienced difficulties and interruptions with access to care services, but also to education. They have had limited opportunities to interact with peers. Social support was lacking and limited for families. Some families, many families, have encountered financial challenges and impoverishment. And we have learned from, the emerging literature that children have suffered in terms of their well-being, their development. There have been a significant impact on children and young people's development and mental health trajectories. And that has been particularly important when their caregivers have suffered from, in terms of, emotional distress, or they have been directly impacted in terms of financial challenges. And I share this reflection, a more generic reflection on the COVID pandemic and impacts on well-being and development of the general population. Because, as I reflect on this, I think, that many families and children with autism have experienced this type of, difficult situations even before the COVID pandemic. They have certainly, experienced limited access to opportunities for care and education. They have had, restricted access, in terms of opportunities for interacting with peers. Their families have often experienced impoverishment, and, they have experienced emotional distress. And, on top of that, a lot of stigma and discrimination and feeling of guilt in relation to having a child with autism. So I think, we need to, exploit the opportunity of the current COVID pandemic to build back better in terms of really, building and promoting a culture and a society that values the development and the well-being of children, all children, including children with autism, and supports carers and families, and value diversity. So this is the first reflection. From WHO perspective, we are cognizant that promoting societies that value, that have a better understanding of autism, means also promoting a different. Promoting knowledge around autism within the healthcare system, starting from, the GPs, the nurses, everyone, that is working and is part of the health workforce needs to have a good understanding of autism in order to be able to be part of that, enabling an inclusive environment that address and abolish barriers for accessing care. The second reflection is specifically about the opportunity of learning from the increased and accelerated, experiences with using technology in the context of delivering care. for persons with autism and other neurodevelopmental disorders during the COVID pandemic. This is a very narrow perspective. I want to acknowledge that WHO has committed to improving care for persons with autism, and the World Health Assembly adopted a specific resolution on comprehensive and coordinated efforts for management of autism spectrum disorders in 2014, which recognized the importance of addressing improvement of, for instance, health information systems, policies, and other aspects that have an impact on the lives of persons with autism. But this is a narrow perspective around technology and care services for autism. During the COVID pandemic, we have had many countries and care providers in those countries have had to really, become innovative in terms of trying new strategies to exploit technology to deliver care services that were no longer, available to persons with autism, and also particularly children with autism and their carers. And this has really, resulted in increased knowledge on the feasibility of using technology to promote more scalable strategies for providing supports and care for children and families. From WHO perspective, we have worked along with other collaborators and experts, and with support from Autism Speaks, to make available a digital platform that can be used directly by caregivers of children with autism and other developmental disabilities, for them to have access to evidence-informed training and skills building materials that can enable them to enhance their skills for promoting the development and the acquisition of skills, and also the promotion of the well-being of the carers. So with positive outcomes on children with autism and developmental disabilities, as well as the well-being of the carers. These training materials are being field tested with users, and will be released by the end of the year. WHO and UNICEF, with support of Autism Speaks and other partners, are also expanding the capacity building materials available for providing care for persons with and children with developmental disabilities, including autism, by making available a competency-based type of training materials using a tiered approach for building, for training a range of care providers with a focus on community-based care and primary health care. So with this, I would like to thank again for the opportunity to join, and reiterate WHO commitment to work along with other partners, other UN agencies and member states towards promotion of inclusive societies and better care for persons with autism. Thank you.
Thank you very much, Dr. Savilli. It gives me great pleasure to introduce our next speaker, Mr. Mohammed Mohsin, who is the Director of Strategy and Sustainability at the MADA Assistive Technology Center. Mr. Mohsin, I have two questions for you. MADA is known for its suite of programs and services, from digital accessibility to innovative opportunities for persons with disabilities. And Qatar ranks the first worldwide on Digital Accessibility Rights Evaluation Index, or DARE. How have you been supporting your clients during this past year? And as a follow-up, clearly, partnership and collaboration are going to be essential for the global autism community recovery from the pandemic. What do you see as opportunities for MADA and the partners in both the private and the public sector to contribute to an equitable recovery? Mr. Hossain, the floor is yours.
Thank you, Dr. Andy, and thanks to the permanent mission of the State of Qatar and other permanent missions and the co-hosts. First, I'd like to kick off my remarks with a short brief about MADA Center. So MADA Assistive Technology Center Qatar is a private institution for public benefit. It was founded in 2010 as an initiative that aims to promoting digital inclusion and building technology-based community that meets the needs of persons with functional limitations, persons with disabilities, and including the persons with autism. To move to how we support our clients, so we do that through strategic partnerships. The center works to enable the education and culture and community sectors through ICT to achieve an inclusive community and education system. Our goals are, we achieve our goals by building those partnerships locally, regionally, and internationally, by building the partners' capabilities and supporting the development and accreditation of digital platforms in accordance with international standards. We also tend to raise awareness, provide consultation services, and increase the number of assistive technology solutions in Arabic through our programs. We do all that with the aim to enable equal opportunities for people with disabilities, including persons with autism, the elderly in the digital community. To move and focus more on what we did last year through the pandemic and our efforts, I would like to highlight some of our efforts and initiatives. So in terms of access to information during this period, which proved to be a vital area, we did launch two accessible platforms that support access to inclusive information in the education and culture sectors. These platforms provided the necessary information about key services to all members of the society, especially PWDs. These are available online on our website. They tend to have the education platform, the inclusive education platform, tend to have multiple resources that not only people in Qatar or the education system in Qatar, but in the region and even international can use as a guide and as references. In addition to the culture, we felt that was a necessary step due to the lack of centralized or a collection of resources. As my colleagues have mentioned earlier, the education system was hit hard as all the education moved to online. On the other hand, I'd like to also highlight what we call the MADA Assistive Technology Portal. It's a very unique portal that provides information about assistive technologies that can serve persons with disability, including the persons with autism and autistic children. We also have worked hard on that platform in the last year to have it updated to provide all specialists and teachers, parents, etc., with the necessary information and guidance in terms of the use of assistive technology, as mentioned earlier. On the other hand, I would like to also highlight the Meta Innovation Program. As you've mentioned, the Meta Innovation Program is a program that we launched and designed a couple of years ago and have been working on successfully the past years. It aims to encourage innovators to create Arabic solutions for persons with disability, thus increasing its availability within the region through a combination of grant programs. As some of the speakers have mentioned, we lack maybe in the region the Arabic localized assistive technology or innovations or even solutions. So this program aims to support anyone with an idea or localize those ideas to make them available to the public and to the specialists. And when we talk about the Meta Innovation Program, I'd like to always highlight the Tawasul symbols, which was one of the key outcomes of this programs. Tawasul symbols is, in simple terms, a set of open source localized symbols that aim to help persons with autism and communication difficulties have more effective communication in all situations. The Tawasul symbols were created a couple of years ago, but we have worked on them a lot last year, and now we have reached around 1,600 localized symbols. You can find them through our website. Those symbols are used by applications and other innovations to provide support localized AAC solutions. And for the pandemic, we have created a series of symbols just focused and tailored for the pandemic and the measures that we need to do. And we even have developed a guide using these symbols for all the persons with autism and how to care for themselves during this period. And we have published it on our website and had a lot of traffic and a lot of visitors for that resource in the past year. When we talk about solutions, we also are proud that we have established more than 20 major assistive technology stations. As mentioned earlier, assistive technology plays a great role in supporting persons with disability and especially persons with autism during this period since everything have moved online. So these 20 major assistive technology centers, stations, basically they were distributed among the education, culture, health sectors with the aim of supporting the needs. 80 stations provide specialists with the latest equipment and ICT solutions for the available in the available field. And these stations make it easier for people with disability to access in a very short time and take advantage of them. We even launched our latest assistive technology station 2 weeks ago in a key college in the country. So we're proud of that. And assistive technology, as mentioned, and the stations they come in hand with building capability, which is something that we tend to provide to all our partners. Building capability, we build capability in teachers, specialists, to make sure they are able to help the community. We have dedicated sessions and training programs for people dealing with people with autism. We had 8 sessions last year and they were all online successfully. And also worked on multiple best practices and guides throughout the year and have published them on our website. And just to conclude, all this work has resulted, and our effort and Qatar's effort have resulted in us being proud to have ranked first worldwide in the Digital Accessibility Rights Evaluation Index, their index, something that we are proud of, and we aim to continue to work more. And regarding your last point about the collaborations, we value these collaborations, and we tend to increase our collaborations not only on a local level but in a regional and international level. We have multiple partnerships with ITU, W3C, and other entities around the world because we believe there's still a long way to go. A lot of things that can be done to support people with autism and people with disability and even the elderly to make a difference and to help them live normally through these periods and in general. Thank you, Dr. Andy.
Thank you so much, Mr. Hossain. I'm very pleased to introduce our next speaker, Dr. Carrie Margot, who is a professional speaker, best-selling author, autism entertainment consultant, and autism self-advocate. Carrie, I have 2 questions for you. For over a year now, the pandemic has disrupted and upended lives and routines everywhere, including your work as an advocate, speaker, and consultant. Please share with us some of the key challenges that you had to navigate over the past year. And looking ahead, how do you think technology can help autistic adults like yourself participate in and benefit from building back better? The floor is yours, Carrie.
Well, first off, thank you all so much for having me here today. Being thrown off your routine and struggling with unexpected transitions could be a challenge for any one of us. But because of my autism, some of these obstacles brought up by the coronavirus outbreak heightened my reactions exponentially. Growing up with autism, transitions and sensory challenges were 2 of my greatest challenges. Though I didn't say my first word until I was about 2.5 and didn't start speaking complete sentences till I was about 7, it was never as big a barrier as my difficulty with those transitions and sensory difficulties. I'm happy to say today I have worked through most of my challenges and I'm one of the few openly autistic professionally certified speakers in the world. Most people even come up to me today and they say, you have autism, but you don't look like you have autism. I still do. I have an invisible disability and still deal with sensory and other limitations to this day. In March of 2020, I was very looking forward to World Autism Month and also World Autism Awareness Day, traveling worldwide, promoting autism acceptance, understanding, and inclusion. But unfortunately, due to the coronavirus pandemic, one by one, every event for the next 6 months for me was either postponed or canceled. And this made me deal with a lot of routine changes, along with many in our autism community have struggled with their mental health during these times because of that change in routine. And others, unfortunately, have dealt with difficulties with regression due to the lack of in-person therapy opportunities as well. For me, my schedule was drastically changed. I experienced burnout multiple times as each group I work with contacted me asking me to look at my calendar as soon as possible for new dates. Simultaneously, I had to cancel every flight and hotel room I had scheduled throughout that time. And I thought to myself how during World Autism Month of 2019, I kicked the month off by talking to government officials in Egypt while also lighting it up blue, the pyramids, and how this year of 2020, I would be doing most of my presentations via Zoom. I began to question my revenue stream and looking towards the future, what I would do for a living. Aside from speaking as an autism entertainment consultant, I try to bring a realistic portrayal of disabilities to our entertainment industry. Most films I unfortunately was working with due to this time pushed their production back to at least mid-2021 with cancellations still going on and pushback dates. Despite this, I tried my best to help our community during this time because there were so many people struggling. My nonprofit KFM Making a Difference continued to provide scholarships, 18 scholarships in 2020 for autistic college students to go to college. And last October, to help small businesses that hire autistic employees, we provided small business grants to them. In terms of the future, technology can truly play a vital role for our autistic community, especially autistic adults like myself. Technology already provides a medium for non-speakers in terms of augmented and alternative communication worldwide. Reliance on technology during the pandemic presents a true opportunity. I believe the continuation of building, for example, on online communities can be a benefit. When I received my doctorate in 2019 in educational technology leadership from New Jersey State University, I wrote my dissertation on the perception of resources for parents of children with autism who are part of online communities. In my research, I realized how online communities can truly benefit autistic parents. Building in these online communities can also provide emotional support and helps nurture autistic self-advocacy. To help as a mentor, I continue to provide support via my video series called A Special Community, where I sit down with self-advocates to give them a platform to share their story via my Facebook page, Carrie's Autism Journey, where now I can say we celebrate neurodiversity, but we've also had the opportunity to surpass over 200,000 Facebook followers to give a national platform to many local self-advocates across the globe. While autism is a spectrum and no two people are alike, if you met one individual with autism, you met just that one individual with autism. Autistic adults have truly been able to thrive in the workforce as technology has been able to dramatically help them. And again, it is based on the spectrum. But some individuals have been able to focus on things such as one-on-one projects while working remotely. That's been a benefit. Video conferencing such as Zoom has also allowed us to focus on less things that may be a challenge for us, such as eye contact, and also not dealing with barriers when it comes to things such as public transportation. You all today can help autistic people by providing reasonable accommodations in your areas, encouraging technology focused on areas such as, for one, vocational assistance, social networking to build on social and communication skills for those on the autism spectrum, video modeling to help teach autistic adults in visual ways, such as helping them find meaningful employment, advocating for additional funding and training on teletherapy, and having autistic speakers come to your area to educate on autism to help reduce autism biases while reinforcing why technology can truly be invaluable. I'm making my promise to everyone listening today that I will never stop advocating for reliable autism resources across the lifespan for all those in our autism community, the over 70 million worldwide who have an autism spectrum diagnosis, to help them live the best quality of life possible. Thank you all so much.
Thank you so much, Carrie, for sharing your experience and thoughts. I'm very pleased to introduce our next speaker, Dr. Bismadev Chakrabarti, who is a research director, Center for Autism at University of Reading, as well as the research director of the India Autism Center. Dr. Chakrabarti, I have two questions for you. One of your research interests is digital phenotyping. What is it, and how technology like yours can help with pandemic response and recovery? And please share with us the ways the pandemic has affected and informed your research priorities. In other words, beyond the impact on your research program at the two centers, did the pandemic influence your thinking about where your research and indeed the whole field should be going? Dr. Chakrabarti, the floor is yours.
Thank you, Andy, and thank you to this wonderful organizers, Your Excellencies, for this platform. So I am a neuroscientist by training, and I am an autism researcher. So one of the big areas of work that we do is digital phenotyping, and this is essentially just a term to encompass all the work that's going on in the laboratories with various technologies, whether it is eye tracking or psychophysics, or there's various complex technologies that we translate to mobile technologies, possibly using mobile phones and tablets, so that we can take them out into the field and scale it up. So digital phenotyping is an umbrella term that really covers this whole enterprise of moving lab-based neuroscience to the field. And our group, our research group, and our collaborators have been working in this field for some time. And to give you a simple example, one of the common lab-based tests for many children with autism who take part in research is to look at social and non-social stimuli. So this would be examples of a child on one side of the screen and a train on the other side, and people would often say that many autistic children tend to look more at the train than the child. And this is usually done using an infrared eye tracker, which is a very complex equipment. But we have now developed technology that we can use the front camera of the tablet and some interesting machine learning techniques to tell with reasonable accuracy whether the child is looking at the train or the tablet, which automatically means that this technology is now ready to be scaled up. So in addition to tests like these, there are various other measures that we have been working in the lab that we are now translating slowly to these mobile platforms. Now, this is the enterprise of digital phenotyping. Now, with COVID hitting us, this suddenly becomes a very important direction in which research should really flow into, because of the difficulties. People already had a lot of difficulties in reaching proper assessment clinics and accessing specialists, especially in India and many other parts of the world. Access is a huge issue. Proper assessments is a huge issue. And so moment we have technology that can allow assessment and monitoring to be happening at a remote fashion, that opens up the possibilities for really countering the negative effects of the COVID pandemic. So beyond the access difficulties that were already there, the COVID pandemic has really kind of exacerbated those negative effects. But having technologies such as the ones that we are working on really takes it, gives some hope to how we can counter these effects. Now, what I have talked about in our kind of work is mostly digital assessments. Now, assessments is just one side of the story. The other side of the story is digital interventions. And again, some of the previous speakers have hinted at that, and that will take even more work. And whether we can completely automate interventions, I am less hopeful about completely automating interventions, but we can definitely have digital aids for providing interventions. So these two things, in summary, these two things about assessment and intervention need to go hand in hand. And the impact of these digital technologies and this research program is possibly only something that we can look forward to as we hopefully move out of the COVID pandemic period and into the next phase of the world. Thank you.
Thank you so much. That's Chakrabarti. For our next speaker, I'm pleased to introduce Dr. Manasi Kumar, who's a senior lecturer in psychiatry, University of Nairobi in Kenya. Dr. Kumar, I have two questions for you. You have also explored digital technology in enhancing care and services, including intervention. Please share with us the opportunity and challenges of using digital technology to monitor outcomes. And you have also written about potential misuse of technology like digital phenotyping. Please share with us your concern as well as the possible solutions, how you may impact their use to support an equitable recovery for our community. Dr. Kumar, the floor is yours.
Thank you so much, Dr. Shi, for inviting me, and thank you for all the distinguished speakers for such insightful presentations, and I've learned a lot. With regards to the first question, I think digital technologies are really important, especially around this global pandemic time. We know, and a number of you pointed this out, that not everyone has access to them. So be it caregivers, individuals with lived experiences, teachers or healthcare workers, certainly in the part of the world where I live, the access is a challenge. At our end, at the University of Nairobi, we are involved in training healthcare workers, both primary healthcare workers as well as specialists, in screening and management using some online devices. And we are working very closely and utilizing the WHO Image Gap, the mental health gap action programs, open access resources, and we are very grateful for some of these tools that are there. Digital interfaces can easily become impersonal, and that's the feedback we've got from a lot of user-centered design testing we've done, and may not capture the complexity of in-person, face-to-face follow-up. At times, facilities don't even have adequate infrastructure for uptake of more complex technologies. So finding optimal interfaces and investments in maintaining and strengthening these is particularly important. Interventions like the caregiving skills training led by WHO, and I know that Dr. Cervelli and Dr. Shi are the face of programs like that, are examples of important initiatives that are there to support caregivers, and leveraging digital technologies to provide hands-on skills to caregivers. They're craving for this kind of a support in this time of need. And this sort of stuff will be very critical. And I was very pleased to learn about the Qatar's Autism e-learning platform. And it sounds like an exemplar, and I would love to learn more and explore opportunities of accessing it. With regards to your question about digital phenotyping, I think the speaker before presented an upside to it and also presented the caveat around its use. So digital phenotyping aims to detect individual behavior, activities, interests, and physiological features to utilize the information to customize the care. That's the digital neuromarketing is another added component that develops tools to capture the unspoken feelings or emotions, desires, and cognition of the consumers to various marketing stimuli to foresee personal decisions, such as purchasing decisions in particular. So it's accessing of biological functions without direct knowledge or consent, and using these complex algorithms to track behaviors and modulate behaviors and practices deserves further scrutiny. And certainly unchecked digital phenotyping and neuromarketing is a real dangerous trend. And countries need to have policies and legal structures put in place to prevent the misuse of data for the big data exercises just for the sake of it, or commercial interests in particular that do not have the well-being of people at its heart. Protecting people from being manipulated by digital phenotyping exercises, has to be paramount in that regard. And countries need to have oversight on digital marketing data and ensure protections are in place for vulnerable populations. In our part of the world, we are seeing a lot of young adults with developmental disabilities and other mental disorders get into alcohol, gambling, other sort of risk exposures through a lot of this digital marketing and the easy access with which these are available. And community and national awareness is the key here. So the public should be educated on the benefits and the harms of using some of these apps or platforms, and public health programs, NGOs, human rights activists, and colleagues that are present here would need to take action on this. And this is of more importance for vulnerable populations, such as individuals with developmental disabilities, particularly autism, in the developing country context, as they are at higher risk of being exploited in such unregulated digital surveillance. So thank you, Dr. Shi, and these were my thoughts around those questions.
Thank you so much, Dr. Kumar. Next, I'm very pleased to introduce our next speaker, Mr. Paul Cutler, who's a self-advocate, college student, and blogger. Paul, I have two questions for you. As a self-advocate who communicates and engages with the world daily through typing and assistive technology, what challenges have you experienced over the past year that was made easier or more difficult by your routine use of technology? And looking ahead, how do you think technology can help autistic adults like yourself participate and benefit from building back better? The floor is yours, Paul.
So we will share screen. We got it right here. We got it.
Listen.
Yep.
Listen.
Can you all see this?
Not yet, no.
Okay.
Chick.
So, hang on. You're fine. You're fine. You're fine.
Take.
I know. Share screen. All right. Can you see this?
Yes.
Okay. So I'll just we'll scroll through this so you can read it. You're good.
Thank you so much, Paul, for sharing your thoughts and your experience during the pandemic. Thank you for joining us today. Last but not least, I have the pleasure to introduce our final expert, Ms. Joanna Brzezinski from Synapsis Foundation in Poland. Ms. Viskel, I have I have 2 questions for you. Please share with us Synapsis Foundation's priority activity in the pandemic response, as well as any plan for supporting an equitable recovery for your community, in our community in Poland. And of course, please let us know what you think are the opportunities for technology to facilitate and enhance these important activities. The floor is yours.
Thank you very much for the invitation. Thank you very much for organizing all this meeting, and thank you very much for the possibility to hear all of you and to share with you our Polish experiences. First, I'd like to say about the first days of the pandemic. For the first foundation was forced to very much reorganize its program activities because of the worldwide pandemic. The sanitary restrictions made it impossible for some time to carry out our direct actions like therapy, the diagnostics, and the trainings for professionals. Some people with ASD were deprived of constant therapeutic support. Some of them managed to participate in online meetings. We consider it an absolute priority to reach the largest possible group of recipients with help and support. We tried to answer any needs that we could answer during this very difficult time. We have developed guides and handful materials for people with ASD and for their parents, for doctors, and for all people around people with autism. I'd like to share with you the materials that my fantastic colleagues worked out during this period, which are put in our website. I'll try to share it. I hope it's fine. We produced some podcasts to share the awareness, to develop the awareness of autism spectrum using the online communication with people. It occurred that many people can get access to these podcasts, which was in fact very good and helpful. Many people who didn't know about autism, they could get this information through this this channel, yes, of podcasts. These are talks with some book authors, with some adults with on autism spectrum about their years at school, with about the role of men. There were talks with fathers of people with autism, children with disabilities. So this is how we tried to manage to share the knowledge, to share the awareness of about autism. Other thing what we try to do is we provided some guides and materials. I'll show you the materials with alternative and augmentative communication for people who cannot communicate in a verbal way. So it looks like this. It's a table for examination at doctor's place, how doctors can communicate to people with autism, and how people with autism can communicate with doctors to tell them the symptoms on their own, not just by the other person, but also on their own, like that I'm in pain, where in my body I'm in pain, that I'm stressed, that I feel hot or I feel cold. So these are the things that might be useful. This is the guidance how to use the table, how to communicate, how you can do this with a person on an autism spectrum. We also tried to continue all our actions if it is possible online. If it's not possible, we try to still continue our meetings in person whenever the restrictions allow to do this. If the restrictions are hard, we cannot provide these meetings in person, but whenever it is possible, we do it. Nowadays, we can provide diagnostics for children and for adults, which happens in person with disinfecting supplies. We use the lamps which go on during the night in the whole building, or during the meetings if it's possible. We use online support for groups of parents. We also provided the groups for parents of children in certain age. There were about 5 or 6 meetings like that, so that parents can meet with professionals, ask questions, ask for help, ask for ideas, how to spend time, how to educate children. We also provided the social stories about coronavirus, about COVID-19, how to explain what that is, how to speak about COVID, about the virus and about the pandemic. Also with visualizations for children, for adults, for youngsters, what we need, like that we need to wash our hands, why we need to wash our hands. It's visualized what we can, what we cannot do during this pandemic, and why is that so? So we tried to help the whole community to function in the best possible way in our situation. The group trainings are still going on for children, in every age children, for little children, for youngsters, for adults. We meet online, or learn how to do it online, what kind of materials we can use. We use virtual games to work on them during the group therapies, how we can use them together, how we can spend time with peers online, not only in person at school, because children do not go to school now in Poland, but they can still meet with their peers from the group or from classroom, how they can initiate contact through email, through other possibilities like social media, how to use social media to be safe, to be understood, and how to communicate. So about the plans, we all would like to get back to our normal functioning as soon as possible, but it all depends on the restrictions. Our most biggest needs are the devices, the software, and the infrastructure to provide safety for children who
Joanna? Unfortunately, seems like we might have lost her.
the skills in person in a concrete way. So this is what we need, and we would like to develop the also the virtual reality to share the diagnosis. So I think it's the best I can tell for now. Thank you very much for the invitation and for all this meeting.
Thank you so much, Joanna, for sharing your experiences and your thoughts. I want to take this opportunity to thank our panel of distinguished experts again for sharing their expertise and experiences, as well as thoughtful perspective about the role of technology in pandemic response and recovery. It's clear that inclusive collaboration at all levels of society are essential for us to reach our shared goals. On behalf of the organizers and co-sponsors of this informative conversation, I thank you all again for joining us this morning. Please have a wonderful day. Thank you.
Thank you very much. Bye-bye.
Bye-bye.
Very good program. Thank you. Thank you.
Bye-bye.
Thank you so much.
Bye-bye.
Thank you,
Bye.
everyone.
Thank
Have
you
a
very
wonderful
much.
day.
Goodbye.
Bye-bye. Kerry, bye. Everyone, bye.
Thank you.
Thank you.